So good morning, good afternoon, good evening to you, wherever you are watching this. I'm Dr. Tiffany Mullen. I'm the CEO and co-founder of Vital Health. I'm a functional and integrative medicine doctor, for those of you who don't know me. And I am excited to have the fabulous Dr. Alicia McCubbins this morning, this afternoon, this evening, join us to talk about hypermobility syndrome and a lot of other related things as it comes to pass. There's a lot of really interesting topics that I didn't even know kind of fall under that different heading. So Alicia, Dr. McCubbins, is a naturopathic physician at Vital Health, and she is a functional medicine expert in lots of different topics, including fertility and also hypermobility, mast cell problems, problems with allergic reactions, et cetera, all kinds of incredible topics, gut health. She's just the master of all of these things. So super, super excited always to talk with you, Dr. McCubbins. Welcome.
Likewise. And yeah, these are topics that I get really passionate about because one, I would say that I'm fairly new to understanding them, but also I think in general, the entire medical model is pretty new to them. So yeah, it's about catching people up, both patients and our colleagues.
Totally. Yes. And I have a lot to learn from you on this topic because I feel like a real true novice in this area. So this month, I almost said August, October, that was wishful thinking, by the way, August. October is National Hypermobility Month and also National POTS, POTS, which stands for Postural Orthostatic Tachycardic Syndrome, which we'll talk a little bit about. Also POTS month. And I think every month has like 18 or 20 or 50 national, whatever, maybe international. So that's why we decided to talk about this topic. And we're gonna get into a little bit about that, but we're also going to be talking about some of the other things that I think are widely applicable to the population that may have some crossover into this area, like osteoarthritis, different kinds of osteoarthritis, pain, and other types of problems that you may or may not have the knowledge, as I haven't before talking to you, that may be related to this topic that you're like, oh, I didn't even know that. So with that in mind, I think it would be really probably a great place to start to what is hypermobility syndrome? What does that mean?
It's a good question. And there's kind of a gradient in that discussion. Hypermobility is what it sounds like. So joints that are too mobile, or so what we'll say is like those people that we consider very gifted for being a little ridiculously flexible. Hypermobile, where like, let's say the fingers bend really far back, thumb can touch the arm, elbows we call like double jointed, someone that can touch the ground without bending their knees. And there's a lot more to that. Hypermobility can be presented as someone who just has a lot of dislocations of like their knees or shoulders or elbows or what have you. So it can show up as early as like toddlerhood too. So, when you start noticing like those nursemaids' elbows, when someone is like swinging their kid and their elbow pops out really easily, that's a potential sign of hypermobility. So these are things that don't just develop with age. But what I'm also screening people for is not just like, oh, are you super flexible? Do you have the genetic condition called Ehlers-Danlos Syndrome? And when we start talking about the complexities around hypermobile patients and what they're more at risk for, or even the EDS, Ehlers-Danlos patients, we start opening up a huge can of worms that can be reflected in their immune system or their nervous system or what have you. So yeah, it's a really big topic, but a lot of people just identify hypermobility as being really flexible or good at gymnastics and dance. But
yeah, that's interesting because I have a gymnast. One of my kids is a gymnast, so I have to keep a lookout because she has had some injuries. I think explainable ones, but yeah. So Ehlers-Danlos syndrome, EDS. Can you talk a little bit about what that is specifically, so that people
differentiating that genetic condition from just generalized hypermobility is a little sticky. again, I think the entire medical model is a very slow to picking up on this. So the way that I screen someone and give them an official diagnosis in office is with a series of questions and physical exams. And unfortunately, it's like not a very flexible test. So even though someone may come to me and like they totally have EDS, yeah, but yeah, I mean, it's like I'll see someone say, "Oh, clinically, it makes sense. They totally have EDS, their family history, all the things." But if they don't have the certain amount of check marks on this official EDS checklist, which you can find online, literally Google checklist for EDS, and you'll see that. If they don't fulfill all those check marks, it's just regular hypermobility syndrome. It doesn't really change the way I address patient care, though. It's helpful for communication with their family and their other providers to know if they actually have EDS, because one of the things on the checklist can be family history.
Yeah. Yeah. Because it is genetic, right? There is a gene.
Yep.
Can you do a genetic test for it?
Yeah, there is genetic testing. And I think depending on who you talk to, that may or may not be relevant. I think a lot of patients will do it just for their own validation, have something else objective, but I rarely will test for it unless I'm suspicious that there's a cardiovascular involvement. There are different types of EDS, and one of them does have a cardiovascular risk profile. And again, that I don't necessarily need to do that gene test, because I will conjunctively work with, a cardiologist where we're doing an echocardiogram to check the valves of the heart, which are also ligaments.
Aren't they also at risk for aneurysms? Is that true?
Yeah.
Yeah.
So one of the checklists is, does someone have a mitral valve prolapse where the valve of the mitral valve is floppy? Another one is aortic dilatation. So where the aorta actually is too large. So yeah, there's a couple of cardiovascular things to screen for.
Also, maybe is there an eye component as well, like lens? I'm trying to think back to my medical school days, but can the lens of the eye be impacted by that?
Maybe.
Like the ligaments holding the lens in place?
Yeah.
Or like a Marfan's. I know it's related.
That might be more Marfan's actually, because it's not coming up in my EDS checklist, but I wouldn't be surprised if that's involved too.
Yeah. So like anything that's a connective tissue basically could, because that's where the target of this problem is, right? It's the connective tissue that holds structures in place that's impacted by this issue, where it's not as strong, or it's not as tight, or it's not as tightly woven. This is kind of how my brain thinks about it. So everything's a little bit loose. And you are more at risk for being able to bend things and consequently strain them and injure them and that kind of thing. So you do a checklist. You are, you're able to examine people, but I mean, even through telemedicine, people can demonstrate their flexibility, and they may even bring it up. They may have even injured themselves more than once, and they're sort of started going down that rabbit hole online of trying to figure out where they fall on the spectrum. What do you do with them once you say, like, okay, they either have Ehlers-Danlos syndrome, and I'm going to, take a multidisciplinary process and make sure that I'm checking all the boxes and making sure that I'm screening them appropriately for all the other potential hazards. If they're not necessarily in that box, what do you do to try to help them with this problem?
So it's all about prevention of injury. And, being someone that was heavily active in sports and especially loved things where I stretched to the limit, being hypermobile, that felt good. I tended to have a lot of injuries of the joints, like lots of sprained ankles, knee injuries, and then even hands and fingers. I mean, everything was, the integrity of that structure was too loose. And so, injuries were more likely. I did much better with compression. So wearing compression sleeves, you see this a lot in professional athletes now, like they have sleeves over their arms, over their legs, it is protecting their joints, having that compression. It's not just from the sense of like it being super tight to keep the joint together. It's also helping with proprioception, which is how your brain perceives where your body is in space. And then also better lymphatic and circulation flow. All of those things can be compromised if your joint integrity is too loose.
Right.
So compression is a big one. And then also like we start talking about, as far as like, are you absorbing your nutrients that also help, the structure of your entire connective tissue? Vitamin C, collagen, magnesium, these are all things that play a big role in your actual physical structures.
Yeah, makes total sense.
Mm.
Glucosamine and chondroitin would be more of a cartilage thing, right?
Right.
Not so much for the structures of the ligaments and the tendons.
Right.
So do you advise people who have hypermobility to avoid certain types of exercises or certain sports?
Unfortunately, yeah. And this has been a grieving process for myself as I've been learning about hypermobility specifically and seeing how it's just been reflected in my entire life. Here I am going on 40 and being like, I'm making sense of it now. I love hot yoga. That has been my addiction since high school, of how to stay fit and healthy. But that has been one of the more damaging types of exercises I could do. Because again, I'm pushing that that stretching to the limit. Feels so good, especially the heat. I go even further, but pushing that hypermobility to the limit can cause like micro damage to the joint. So I've had to really pull back. I think the pandemic helped. I didn't want to go into a hot yoga studio.
Yeah, not a good place to hang out during COVID.
No. Now I'm like, oh, I miss it. But I also am finding ways to support the joints without overstretching. And yeah, I mean, you don't want to take a backseat to your exercise, but certainly that's one way to protect your joints.
Yeah, wearing those protective or compression sleeves would be probably pretty hot in hot yoga, but regular yoga you could potentially with supports and I would say even maybe the right yoga instructor who understands hypermobility and could instruct and support and use props and blocks and things like that you're not pushing yourself in a way that could potentially be damaging. It's because I know people love yoga. People love yoga.
Oh yeah. I still do yoga.
Yeah.
I just, you have to have a lot of awareness around what your body is doing. Also, I think a very important part of treatment when I meet someone that has hypermobility, especially if they're already having issues like chronic pain or anything, is finding a physical therapist that is very knowledgeable in EDS or hypermobility. Sometimes physical therapists will say that they do, and they're just like me wanting to learn and going for it. But there are specific trainings for these folks. And I think that makes a world of difference in patient outcomes.
That makes total sense. Well, you mentioned a few nutrients, supplements that you focus on when you're talking about the health of the tendons and the connective tissues of the body. Are there supplements or any type of medications or anything in that realm, anything in the nutrition realm that you focus on making sure that these folks get plenty of?
For sure. I mean, dietarily, it's always talking about protein and fat and being cautious with sugar. But I think that's like, kind of any anti-inflammatory approach, and that would be extended to any organ system. But mineralization is big. So this crosses over to some of the complexities that comes with hypermobility that we'll get into, but minerals like sodium, potassium chloride, magnesium, all of those are incredibly therapeutic, not just to the structures, but also to blood volume and so on, the nervous system. And my favorite medication that I use pretty loosely, I would say, because it's not used the way the FDA has approved it at 50 milligrams, but at low doses, we use low dose naltrexone. And I that I love this medication and I use it a lot. It's incredible for pain because it is an opiate receptor blocker. And so when you're able to block the receptors, there's an anti-inflammatory response, but it's not a narcotic. It's not an opiate. And for it to be helpful for pain in that context is so amazing, but it also helps the immune system. So there's a lot of uses for this medication.
Such an interesting medication with such widespread use. And when I found out that you were using that for hypermobility, I was like, oh, duh, like that makes total sense. I'd never done that. I had never really thought about it in that context before, but that makes total sense once I started thinking about what hypermobility actually is and what we're doing.
Yeah, it's a game changer. And I mean, even if it's not hypermobility, when we're talking about joint pain, it's also awesome for autoimmune conditions. So, rheumatoid arthritis, one of my favorite medications for rheumatoid arthritis is LDN.
Yep. Yeah. It's amazing. Amazing stuff. Um, and so you mentioned magnesium as being an important one, vitamin C. Nice mug. Vital health mug, some swag. So you mentioned those. Are those typical ones that you supplement, or you just focus on food sources for those, or both?
A little bit of both. I
Okay.
mean, doing some blood work from time to time helps, not necessarily with the minerals, but we take it into a bigger clinical context. Like if someone with hypermobility EDS also has POTS, dysautonomia, minerals like salt, sodium chloride, it's huge. So important for management.
The whole salt, right? The whole mineralized salt. Well, since you brought that up, I'd love for you to talk more about this topic of, and I don't even remember what you called it, a pentad?
Super pentad syndrome.
Super pentad syndrome. So I had never heard of this before talking to Dr. McCubbins about this topic. And this is blowing my mind because I did not know that there was this crossover between hypermobility syndrome and all these other potential things that are involved in this syndrome. So can you talk a little bit about what that is and how they relate to each other?
Yeah, the super pentad syndrome is something that I keep in mind when I meet someone that is hypermobile. And if they have a lot of really like a long list of weird symptoms that no one's been able to explain before, it helps me to go back to that super pentad syndrome and think about, oh, where does this fit under these possible coexisting issues?
Yeah.
So Ehlers-Danlos being number one, and then mast cell activation syndrome, which is MCAS for short. It's basically an immune response that looks like crazy allergies, like where, antihistamines don't always help on their own. So we start looking at mast cells, which are very similar to histamine.
Yeah.
The third thing is dysautonomia. So dysfunction of the autonomic nervous system, which is essentially the nervous system that you don't really control, one that regulates the heart, the digestive system, but also the nerves, we can feel it in our hands, feet, things like that. The dysautonomia is the umbrella term for POTS. So that becomes a really big conversation with a lot of people with hypermobility. The fourth thing is gastroparesis. So digestive symptoms are not uncommon with people with hypermobility, but sometimes it can get severe enough to where, motility really slows down to the point of not moving at all. And so digestion becomes pretty severe in some people. And then the fifth one is definitely very frequent in my hypermobile patients is some level of autoimmunity, whether it's like psoriasis, rheumatoid arthritis, which makes it a little more confusing, Sjogren's, what have you, but it does help to have a really knowledgeable rheumatologist on board when someone's got a very complex presentation.
Yeah, it's so fascinating that all of those things go together. So gastroparesis meaning the slow emptying of the stomach, which for a lot of people feels like nausea, burping, distension of the stomach. Can be
even
really
vomiting, not being able to keep food down.
Yeah. Or I would suggest, and correct me if I'm wrong, but also GERD, like reflux symptoms, because the stomach contents are not moving forward, they can potentially more easily move backwards. So how is there any thought on how these things overlap, or is that not well understood?
I think we have a lot to learn.
Yeah.
And we, meaning me too, I probably could find a better way to articulate it other than just saying, with the hypermobility piece, I don't know how that connects to the nervous system so well. But when the nervous system is involved, everything is involved.
Totally. Yeah.
So we've got nervous system, immune system, and musculoskeletal system all entwined here.
Yeah. Interesting. Well, I mean, the body is whole. And I think that's one of the reasons why those of us who practice functional integrative and naturopathic medicine, we see people as whole organisms. We understand that there's, digestive system and nervous system and musculoskeletal system and, whatever, but we also tend to focus on the areas of overlap where things come together and how one problem can translate into even another area. Whereas I think traditional medicine tends to separate things out and doesn't acknowledge the connectivity between these different organ systems. So that's interesting. Does LDN then help with some of the other conditions similarly?
Totally. Yeah. It's not a standalone treatment for anything, it's a really nice adjunct treatment, but the amount of pieces that it addresses is pretty cool. So yeah, from the autoimmune perspective, it can help with that. I'm prescribing for people with Hashimoto. I mean, anything across the board autoimmune,
Yeah.
even cancer, I will prescribe it with some patients when it's cleared with their oncologist. And then in terms of POTS, sometimes, yeah, it can make a big difference for POTS symptoms, that dizziness, feeling like you're going to faint. The POTS can, people think it's just your heart rate speeding up and slowing down, but if your heart rate is speeding up and slowing down, that has an impact on how blood is getting to the head. And so, that of course you can feel dizzy or like you're going to fall over, or even anxious. So the LDN can help with that.
The POTS, the folks who have POTS, I've had a couple of patients who have been really, really severely impacted by that. It can be quite incapacitating. I mean, all of these problems can be incapacitating. Same thing with mast cell activation syndrome, histamine intolerance. Those are tough because they do have they're not just, I have a runny nose or I have hives. Right. They're really severe systemic responses that can.
And they can come in waves though, so like, I can reflect back on my teen years where I had what was definitely POTS and had no way to articulate my symptoms even. So of course we didn't get very far in like addressing it. But a lot of people will notice that some of these things are becoming more prevalent now in the last couple of years. And it's because viruses can be very triggering to things like POTS, MCAS, especially in the folks that are hypermobile. So yeah, it's a pertinent time to be learning about this, but also it's definitely not new.
Yeah, these viral triggers that instigate some of these problems, even the connection between infectious diseases, maybe not necessarily only viruses, but bacterial infections and the development of autoimmune conditions, the connection between gut health and autoimmune conditions, which is probably has something to do with the bacterial content of the microbiome and one's ability to regulate the immune system in that area. So such a fascinating area with so many potential places to intervene. And I think that's also something that's really important for the audience to take away, is that these are problems that the traditional healthcare system, traditional physicians don't necessarily even know about. They don't recognize the symptom patterns, and then they really don't have a whole lot to offer. That's troubling. And so a lot of patients are walking around, as you did apparently as a young person, with symptoms that probably felt terrible, and nobody really recognizing what was going on.
Especially if they came in waves, and we're really struggling with helping people with long haul syndrome. Luckily, it's not as severe as it was earlier in the pandemic. I think those other variants were much more prevalent in the long haul development, but I still got patients that are dealing with long haul right now. And I can't say for sure, but I think all of them have hypermobility EDS.
So there's maybe that's one of the common things that link that population of people. Like, who are they? Why do they go on to have these problems, where some people get COVID and have no issues at all?
Right.
Pretty fascinating. Can you talk a little bit? So we've kind of been talking about like joints and to a certain extent some organs and things like that. But what is we have at Vital Health, and I think in a lot of populations, we have a lot of women in our practice. And we know that autoimmunity impacts women more than men, generally speaking. What are your thoughts on women who are struggling with pelvic floor problems and potential hypermobility or other types of issues? Because we see a lot of that, especially as women age, moving into perimenopause and menopause, a lot of pelvic floor, even younger, but a lot of pelvic floor stuff coming up for people. What is your thought process around that?
Oh, it's a great question. And that is one of the things on the checklist for EDS is
okay.
Vaginal prolapse, rectal prolapses, anything where you're prolapsing means that integrity of the pelvic floor is loose.
Yeah.
Just like, the joints. So certainly that's something that, postpartum also can be more likely to happen. I'm always screening for that. So pelvic floor is also influenced by hormones too, like that's something that we want to also screen for, is checking in on hormone balance. We have a lot of different ways of testing for that here, especially with Vital Health. But going into postpartum too, like what we see in that connection is not just are you hypermobile or not, and what's the integrity of the pelvic floor, those muscles and ligaments, but also, is there a major drop off of estrogen and progesterone?
Right.
And is that compromising the integrity of the pelvic floor as well? So I am so grateful that pelvic floor therapy, physical therapy, is becoming like conventional, normal, like
yes, right.
accessible.
Yeah, I totally agree. People used to look at me cross-eyed when I sent people for pelvic floor PT like 10, 15 years ago. And there was like one person who did it,
Right.
But yeah, so when you are a patient that has hypermobile problems and you have a baby, should those women preemptively be doing things to prevent postpartum prolapse issues? And
Absolutely.
how do we counsel them better to avoid those problems until they get to the point where it's so bad that they're really struggling?
From an ideal perspective, I think I was a little intuitive about it, but I did pelvic floor therapy in pregnancy.
Wow.
Yeah. And it was more out of like fear of being like, oh, I hope I don't become incontinent after having a vaginal birth. But
totally.
it was more, it was really fascinating to have that experience because there's a lot of biofeedback that they use. So they actually use leads where you can allow your brain to see what you physically are able to engage. And that's a game changer, just to have any sort of biofeedback where, a machine tells you what your brain should be telling you.
Totally. It's an integral part of pelvic floor physical therapy. And what I'm seeing now is there's a lot of biotech devices that are coming into the market in the femtech category, kind of like that term, but for women to use at home, so that you could actually, in the comfort of your home, or even in, things that are wearable and those kind of things where you can actually, treat yourself.
Amazing.
Have been FDA approved. And, so it's going to be interesting to see how much of this kind of stuff becomes a little bit more self-activated, physicians identifying the problem, diagnosing the problem, but then the woman can directly take control of that issue and which is nice.
Yeah. And then, postpartum compression, coming back to like the yoga pants, man, yoga pants are like the gift. They're the best, not because we love them, because again, proprioception, allowing better circulation to the abdomen. If you can get yoga pants that come up high, like high waisted around the abdomen, compression is some of the best, especially for POTS. And then compression socks, everyone's favorite. They are getting better. They're getting cuter and more comfortable. So
they've never been cute. I haven't seen the cute ones, but
there's some cute ones.
Are they? Okay.
Yeah. Oh yeah.
Cool.
Internet.
Right. Find it on the internet. Can you say a little bit, as we kind of wrap things up here, about let's just kind of talk about the relationship, not necessarily the relationship between, but some of the crossover to osteoarthritis, which is obviously a downstream issue that people with hypermobility have, right? Because their joints become damaged from not having the integral support of the connective tissues around them. So they may have suffered many strains or have pushed themselves athletically or whatever. Right. And now they've developed some osteoarthritis. But also, I think in general, osteoarthritis is a really common problem across the population. Are there some things that we can tick off for people that might be helpful for treatment, prevention, support, so that they can continue to exercise and that kind of thing?
Yeah, going way back to more of what we call nature cure medicine, and we overlook this all the time, but it's the use of hot and cold water, right? Like the application of hot and cold, we think of just like, oh, I injured myself, I have to put ice on. It's like, no, the more that you use this very simple medicine, the better it can be for inflammation. So after exercise, taking a cool shower, like a cold shower for 30 seconds is very therapeutic to the circulation, bringing white blood cells to the joint and helping heal that area faster. There's something to that. And even now there's more access to things like cryotherapy or, the cold tubs and all of that. Like that is one of my best tools for inflammation of joints, especially.
Wow, that's fascinating.
Yeah. So we can't overlook the power of like such simple, accessible things, cold water and hot water.
Totally.
But yeah, then beyond that, it's also thinking about all the systemic things that we've mentioned kind of in passing, is like, if your gut health is not optimal, you're probably not absorbing the nutrients that you're needing to have optimal joint circulation. So yeah, I do focus a lot on digestive health, especially when osteoarthritis becomes an issue, or, you know, when we're starting to think about osteoporosis prevention.
Yep.
Like, are you absorbing things? And then again, coming back to like hormone balancing as well. And then in terms of circulation, that's how you're nourishing your joints.
Yep.
It's also how your immune system is healing your joints. So keeping movement going, but having like a lot of mindfulness around safety while doing that, you know, picking the right things for you is big.
Totally. And I think, you know, the hormonal piece, I think a lot of people start to develop issues, especially in menopause, perimenopause phase, a lot of adrenal fatigue and HPA axis issues, where you're just not getting good adrenal support. And you feel like you should push yourself harder, because you're like, well, you know, last year I could do this, and now this year I can't. And all of a sudden you're trying to push yourself, and lo and behold, you're not really helping yourself, you're hurting yourself.
Right.
So gut health, but also adrenal health, especially, you know, in challenging hormonal times, you know, when you're having a baby, or you're transitioning to perimenopause or menopause, or really, I mean, it doesn't matter. You can have it at any time, but those are the times where I tend to think about people thinking that they should continue to do heavy duty everything, and they actually need to sort of scale back a little bit.
Yeah. And I also don't want to overlook the importance of conventional medicine still too. Like, orthopedics are my best friends.
Me too. Put me
not only
together more than once.
Right, I bet. And so, like, you know, if someone is due for, let's say, a knee replacement, entertaining that conversation is really important, so we can do everything we can to prevent unnecessary surgeries, but it can be life-changing when someone has that addressed. Right.
Yes, I'm one of them. So for all of you out there, like I was resisting an end stage joint, which I had and really, you know, obviously it's a big decision to make, and it's nothing that you want to take lightly. But I like to think about it as, once that joint stops driving so much inflammation in your body, the aches and pains that you have in a lot of other places, they also get better.
Yes.
You know, so the knee will definitely, in my case, the knee will definitely get better, but then the other joints that are being perturbed by all of that bone on bone stuff really definitely helps to take that step, even though, again, it's not an easy one. It's changed my life. I am so glad that I did that 6 years ago now. So it's still holding really well. Replacements have come a long way. They're not nearly as bad as they used to be. So yeah, you're absolutely right, and thank you for calling that out. That there is a role for traditional medicine, physical therapy, orthopedics, sports therapy specialists, you know, to really intervene on some of these situations.
Definitely. We are functional medicine specialists, but it comes from a place of finding balance, right? Within all contexts.
Yeah. So. Yeah. And physicians first, right? We're docs. So we recognize the whole scope of what people need to do to get healthy and stay healthy. So, well, this has been a really, really cool conversation. I actually learned a lot. I'm almost embarrassed at like how much I learned. I'd never heard of this pentad before. And so now my ears are going to be like listening in a different way.
None of this was in my education 10, 15 years ago, you know, so we're learning a lot. And, you know, my goal is for myself to stay abreast on all the information, but my patients are teaching me a lot too. Yeah, so I hope that this helps.
Me too. Cool. Well, thanks very much. As always, the inimitable Dr. McCubbins. Yes. Thanks for your time this morning.
That was fun. Thanks, Dave.